Good morning. Welcome. My name is Annette I. Williams. I am the outreach coordinator here at Work Life Services and the Office of the Chaplains. Work Life Services is one of three mental health units here at the MTA. The other two are managed by Long Island Railroad and Metro North Railroad. On behalf of the MTA, I want to thank all of you, agency-wide, for your tireless dedication and commitment. None of your efforts and sacrifices have gone unnoticed. I also want to thank you for your daily contributions towards making this organization one of the greatest transportation industries. To the team that worked tirelessly to put this town hall together, thank you for your vision and insights. The past year has been very challenging. It has been like a long road trip with children. We know after a while, the children start to ask, are we there yet? How much longer? And then we hear, I'm bored. MTA family, we, along with the world, have collectively been experiencing a surreal road trip. It has been physically and emotionally draining. We, like the children in the car, are asking the same questions, particularly, how much longer? We are not bored, but we are fatigued, COVID-19 fatigue, and we want to get back to what was familiar, our own normal. Today, we have joining us two experts in the field of COVID-19 vaccine. And they're here to provide us with information about the vaccine and our journey towards getting there, getting to our normal. There will be a question and answer session after the presentation. But before I introduce the speakers, I want you to understand how that session is going to work. Should you have a question, you can feel free to type it in the Q&A box, and at the appropriate time, a member of the town hall team will read your questions to the doctors. You do not have to wait until the Q&A session begins. You may type your questions ahead of time or as they pop into your head. Please note, we are kindly asking that you keep your questions relevant or to the topic of the town hall, which is COVID-19. Also, just so you will know, this session is being recorded and will be available after. After the presentation, I will provide you with links. Thank you for your cooperation. Today, we are honored to have as our guests Dr. Torian Easterlin and Dr. Olusimbo Ige. Doctors Easterlin and Ige are both experts in their field. They have graciously agreed to join us and to share information about the COVID-19 and the COVID-19 vaccine. I would now like to introduce our speakers. Dr. Easterlin and Dr. Ige are from the New York City Department of Health and Mental Hygiene. Dr. Easterlin is the first Deputy Commissioner and Chief Equity Officer, and Dr. Olusimbo Ige is the Assistant Commissioner for Health Equity Capacity Building. Dr. Easterlin and Dr. Ige, welcome. On behalf of the MTA, I would like to thank you for agreeing to join us today. We are honored by your presence and look forward to hearing from you. Ladies and gentlemen, honored guests and colleagues, without further delay, Doctors Easterlin and Dr. Ige. Doctors.
Thank you so much, Ms. Williams, for the kind introduction. I must say that the honor is both myself and Dr. Ige to be invited to share an update on COVID-19 as well as our vaccine distribution plan here in New York City. we know that the Metropolitan Transit Authority has been at the front lines since the very beginning of this pandemic, and has certainly impacted all of the workers, leadership, and families in big ways and in small ways, but we all know that we've been impacted by this. And so just want to thank you all for the work that you continue to do, the critical service that you continue to provide, the warm smiles that you often give and may go unnoticed, because it does go a long way just to make sure that we're continuing to support New Yorkers in every way that we can. And so it is certainly our honor to be here to share this information with you all, because ultimately we understand that this recovery has to be a collective action. We have to do it together to get to the end of this pandemic. And we certainly have to continue to support each other as we recover, because this is going to be a long road. So we must do it together. So with that, I do just want to, again, just introduce myself. My name is Dr. Torian Easterling, serving as the first Deputy Commissioner and Chief Equity Officer at the New York City Department of Health and Mental Hygiene. And I'm honored to be joined by Dr. Olusembo Ige, who is the Assistant Commissioner for our Bureau of Health Equity Capacity Building, which sits within the Center for Health Equity and Community Wellness. The agency has continued to put equity at the front and center of how we look at our response, but overall how we address health outcomes. And the leadership really has to also reflect the way in which we are thinking about how we implement an anti-racist public health practice. And so really, really humbled to be joined by Dr. Ige and really honored of all the work that she's been doing. And so with that, I do want to thank Mira and Jesse for working with us in preparation for this presentation. So we'll go through a couple of slides and then we'll spend the bulk of our time addressing questions. So next slide. The first thing that we always start off with, and it's important to sort of put this into context, where we are in this city. We are still seeing persistently high number of cases and percent positivities, hospitalizations, and death. We certainly expected that as the vaccines continue to roll out in this city, that we would see a sharper decline, and we're not there yet. And I think this is really important to just drive home the point. And as you can see on the map on the left-hand side of the screen, we see across the city where there are still high percent positivities. And so those are individuals who are testing positive. And so although we're seeing fluctuations in the number of tests performed, we're still capturing the individuals who are testing positive. And so that indicates to us that there is still high disease transmission in communities. And so we have to continue to do all the things that we have been doing for this year. Our prevention measures, getting tested, and also when you're eligible, getting vaccinated. On the right-hand side of the screen, just showing our FB curve. And you can actually stretch this out from the beginning of this pandemic and be able to see the waves during this pandemic. But really, we're just focusing on the latter half of the curve and really showing how we're still seeing a high number of cases. And this is citywide. So really just driving home the point that we have to continue to do all the things that we know that is working. Next slide. And so what are the ways that we have been talking about? Essentially, these are our safe six. We know that if you are sick, please stay home. If you tested positive for COVID-19, recently traveled, really important that you continue to quarantine yourself or isolate yourself if applicable. Wearing face coverings, as you all know, really important, making sure that you have the guidance and also encouraging others to really make sure that they continue to wear their face coverings 6 feet apart, maintaining the distance, and also washing your hands or using hand sanitizer. We're still advising avoiding travel and gatherings at this time, really trying to minimize spread and close contact, but certainly, as you may know, we'll get into this a little bit more, how the CDC has also allowed less strict guidelines or guidance for individuals who are fully vaccinated, and we can talk a little bit more about that. In December, so late last year, our Commissioner of Health put out an advisory to really ensure that New Yorkers, to protect New Yorkers who had underlying chronic conditions or if they were over the age of 65, really encouraging them to make sure that they follow the guidelines, all of the Safe Six, making sure that this also applies to their caregivers and household members, but really limiting travel, limiting contact with others, just because really wanted to make sure that as we knew that the spread, the community transmission was happening, we wanted to make sure that folks were being protected. Next slide. We've updated our face covering guidance, and this is guidance based on the Center for Disease Control. And so better protection is afforded by wearing two masks, a cloth mask over the disposable mask, and this actually improves the fit and added additional layers. It is advised that you can use a higher grade mask, such as a KN95, particularly for those who are higher risk of severe illness. And so if you have underlying chronic conditions, such as diabetes or hypertension, or you're over the age of 65. We've seen in our data, certainly early on in this pandemic, that those are the categories that we've seen higher risk of severe illness. And so we put out the guidance, and certainly, I've been following it, wearing my disposable mask directly over my face and then adding a cloth mask on top of that. Next slide. And so now we do have a vaccine to add to our toolbox. We are continuing to do all of our prevention measure strategies, as I've talked about, our core four, getting tested as well. And certainly, I know that testing is available to your workforce. It's certainly always good to have the number 212 COVID-19. That number, you can also access testing locations across the city, and really important to have that. And then the vaccine rollout. And so our campaign is simple. We want vaccines for all New Yorkers, and they are safe. They are no cost to New Yorkers, and they are highly effective. And so we'll walk through, what our strategies have been, go over the basics of the vaccines, and then again, we'll answer some of your questions. Next slide. So where are we at? In the United States, over 145 million doses have been administered in the United States, and over 52 million people have been fully vaccinated. And certainly that is a huge feat, and a lot of great work has been happening. And certainly we need to continue to do more. Here in New York City, we're close to 4 million doses having been administered in New York City. And certainly that will be a major accomplishment when we get there. And certainly we're on track to reaching 5 million doses, as the mayor has announced that we want to get there by June. Fully vaccinated, we're almost about 1.5 million New Yorkers haven't been fully vaccinated, but certainly we want to continue to push forward in making sure that all individuals, especially with the 2-dose series, are completing the full series. And so that's making sure that you have both doses, and then after the 2 weeks of being vaccinated, then you are fully vaccinated. Next slide. And so this sort of outlines how we're looking at our data. So you can actually go onto our website. In addition to having the data related to cases and percent positivity, hospitalizations, and death, we also provide that by neighborhood. We're also providing data for individuals who've already received doses, showing that by citywide, showing that based on neighborhoods, who's received at least one dose, and the percentage of those who are fully vaccinated. And so you'll see on the left-hand side of the screen, the percentage of New York City adult residents that have received one dose or more by zip code. And so if you're on our website, you can actually hover over one of the neighborhoods, and a pop-up will come up that will allow you to see the percent of at least one dose in that neighborhood, and the percent of those who are fully vaccinated. The darker shaded neighborhoods are those that we're seeing higher uptake. And certainly we want to see the full map that is shaded darker blue that really indicates that we have deeper penetration. We're getting more residents in each of these neighborhoods vaccinated. On the right-hand side of the screen, we're showing vaccination of New York City adult residents by race, ethnicity. And so you can see very early on that there are those disparities by race and ethnicity. But I will say that two things that we have improved. We have improved over time, narrowing the gap. And it has not happened as rapidly as we would like, but certainly there has been some progress. The other thing that we have been certainly monitoring are the providers as they're reporting who's being vaccinated, making sure that we are getting reports of race, ethnicity, so that we can better track this information. When we first started this vaccine distribution plan, almost 40%, 45% of the reports that we were receiving did not capture race and ethnicity. And now we're down to about 13% of those reports where there's missing information. So that's a huge progress. But certainly what this allows us to do is have more information. And then that information provides a roadmap about how we can achieve our equity goals, making sure that we get to those who are most vulnerable, and really make sure that we're getting to vaccines for all New Yorkers. Next slide. And so just to talk about our strategy, as I mentioned, we focus on an equitable distribution from the very beginning. And part of that is acknowledging the historical and contemporary experiences of injustice that does happen in healthcare. We're very clear that there have been reports even during this pandemic of the type of treatment in healthcare that has led to poor health outcomes, and particularly in Black and Brown communities. And so acknowledging that history in the contemporary current experiences allows us to have a much broader conversation and not just focus just on the vaccine, but what are possibilities beyond the vaccine, and how do we build trustworthiness for our government. Working to ensure access and confidence in the vaccine has been a priority of our rollout. We have a vaccine command center that is led by our deputy mayor for Health and Human Services. But really the crux of this is built on marshaling all of our resources across the city administration. And so not just the New York City Department of Health, but also our New York City Health and Hospitals, our Mayor's Office of Emergency Management, our Test and Trace Corps. So really leveraging all of these resources to make sure that we really are using our resources to make sure that we can get vaccines into the arm of New Yorkers. This has been unprecedented collaboration, not just within city government, but also at the state and federal level, as well as working with community partners across the city. Next slide. So the basis, and you've already heard me say this, that the vaccines are safe and have undergone rigorous testing. They have went through all of the steps as usual for vaccine development and monitoring, going through all of the phases of a clinical trial, and certainly going through a number of advisory boards to really look at the data and ensure that the vaccines are safe and effective. Certainly they are recommended for individuals, even if you've already had COVID-19. And so certainly if you have some level of natural immunity, not enough information is known about how long that natural immunity is going to last. And so it is definitely recommended for individuals who were previously infected with COVID-19, or if you've been treated with antibodies, monoclonal antibodies as well. Now you do need to wait at least 3 months, 90 days, if you've been treated with monoclonal antibodies before you're vaccinated, but you should certainly be vaccinated with a COVID-19 vaccine. None of the vaccines contain the virus, the actual COVID-19 virus, the SARS-CoV-2. None of them contain the actual virus, and they do not alter your DNA in any way. So we have 3 vaccines, and they've all received emergency use authorization approval from the Food and Drug Administration. we have the Pfizer and the Moderna vaccines. Both those vaccines are mRNA vaccines. Essentially, they deliver a message into the body. The protein particle is replicated, and then that protein, then your body then develops a response, developing antibodies. And so when your body recognizes that protein, they're able to get rid of the virus itself. And so really important that people know that the material that comes in is also deleted, permanently removed. And so it does not stay in your body, does not enter any nucleus or any form of your cells. And so just provides you the protection that you need against COVID-19. And so both are mRNA vaccines, the Pfizer and the Moderna. They're both 2-dose vaccines. The Pfizer, you do take the second dose after 3 weeks after you've taken the first dose. The Moderna vaccine 4 weeks after your first dose. The Johnson & Johnson is a viral vector vaccine. Is very similar to how the flu vaccines operate. It is only a 1-dose vaccine, but operates in the same way, delivering that information into your body, giving your body, the information that it needs to actually replicate a protein, and then the body then mounts the response by developing antibodies, so that you now have that information, that code to recognize those proteins if the COVID-19 virus does enter your body, and you can get rid of it. And so really important, just to reiterate, they're safe, highly effective, no cost to any New Yorker or to anyone. And so really important that if you're eligible to get vaccinated, that you do get vaccinated as soon as possible, but continue to wear face coverings, continue to do all the things that we know will keep people safe. I received my vaccine, both doses. It is already 2 weeks after my second dose, and so I am fully vaccinated and really happy to have that level of protection. Next slide. So, as I've already mentioned, unprecedented collaboration with both the federal and state government to make sure that we continue to receive our allocation for doses. And so, as you've already heard, the governor has expanded the eligibility criteria to include individuals now 30 years and older. And so now we really are making sure that as we receive our supply, and we have received a steady supply here in New York City, now making sure those access points can really support individuals to really schedule an appointment. Next slide. And so based on CDC guidance, New York City State determines the eligibility criteria and really sets when adults are going to be eligible. We started off with people who have been at increased risk of exposure, and so thinking about our healthcare workers, thinking about individuals who live in long-term care facilities. But again, as of today, we now have individuals who are eligible, who are 30 years and older, and very soon that eligibility will include individuals 16 and older based on the Pfizer vaccine, which is eligible for 16 and 17-year-olds. The Moderna and the Johnson & Johnson is only eligible for individuals 18 years and older. And so really important now that we are seeing an expanded eligibility criteria, really making sure that we continue to prioritize those individuals who are most at risk, and so really thinking about our seniors, 65 and older, to make sure that we can support them. And so even though we are opening up, if you can continue to support older adults in your family, helping them schedule an appointment. The city, we are continuing to prioritize our seniors and making sure that we can match them up with appointments. And so that's really important, even though we are making sure that other sites continue to support all eligible individuals to get vaccinated. We're certainly very close. We were anticipating mid-2021 where we would have enough vaccines to be able to vaccinate all eligible individuals. Certainly, we're hearing that may come sooner, around May 1st, and so certainly we're trying to prepare for the influx of supply that will really allow for individuals to get vaccinated. Next slide. And so, as I talked about, a priority for us has been access and building confidence, and how we have done that, as I've talked about, acknowledging historical and contemporary injustices, keeping equity front and center. We've really been making sure to work with priority groups, making sure that we're partnering with community-based organizations, thinking about how we make our sites more accessible, not only thinking about disability, but also language as well. And so we've really been trying to be responsive a lot to our community members and making sure that we can really help them schedule appointments using our call center, but then also navigating the locations and so that they're able to get vaccinated. We've been working with the New York City Task Force for Racial Inclusion and Equity to make sure that we're prioritizing communities that have been disproportionately impacted. And then those partnerships has really served to be fruitful to making sure that we're really getting out, deploying canvassers, scheduling appointments, and working with community-based organizations. Next slide. And so we're continuing to expand the number of sites. We're working to move out of high schools as high schools have reopened for New York City high school students. We've already moved out of 3 high schools, and we're moving into additional locations, sort of our DOHMA's vaccination sites. There are mass vaccination sites across the city, and then we also have been working with a number of houses of worship and community-based organizations to also stand up sites. But certainly know that your workforce does have access to the Javits Center, and certainly we think that has been a really strong relationship and partnership. And certainly we are looking at other workforce to really support our workforce in getting vaccinated and really facilitating access to a number of different sites. Just this past week, working with 32BJ and DC 37 at our City Fill site. And so really making sure that our workforce can get vaccinated, are protected so that they can continue to perform the critical service. The way in which we have made vaccines available is through scheduling appointments. And so on our website, logging on to Vax4NYC, and then allow.nyc.gov, making sure that individuals know all of the different sites that are available. You can also call 877 Vax4NYC and speak to a call agent. And really, through our call center, we were really trying to prioritize our seniors, making sure that they can schedule appointments as well. And as I've already alluded, we're partnering with a number of different community-based organizations who are deployed in communities and helping New Yorkers also schedule for appointments. You should also know that for our seniors, we do have transportation options that are available, both a cab service as well as an ambulance service, to make sure that we are providing access to our seniors. I spoke about language. You should also know that we do have a homebound program that New Yorkers can submit the name of someone who is fully homebound and can receive a visit from a provider to get vaccinated, and they'll show up at the home, but also the caregiver as well can get vaccinated along with that individual who's fully homebound. Next slide. And so we'll talk a little bit more about this, but as far as building vaccine confidence, where we've been doing a number of different town halls and community conversations, providing capacity building and technical assistance to our community-based organizations. And as I mentioned, doing a lot of different outreach and engagement through in-person activities such as canvassing, robocalls, text messages, and emails to really get the word out about eligibility, the sites that individuals can access, and making sure that we have collateral going out as well. The message is important, but the messengers are just as important. And so again, happy that Dr. Ige and I can join you. But certainly we know that our community-based organizations, faith leaders have also been critical to helping getting the message out as people are getting vaccinated, to say also, you see me, I'm getting vaccinated, I'm fine, I may have experienced some symptoms, but this is the way forward. I'm doing this for myself, I'm doing this for my family and my community. And I think having those conversations with community leaders, but also having the ability to show and model for others really has been impactful. Next slide. So I think it's really important, continue to share the information about how individuals can schedule appointments through our website or calling our call line at 877-VAX4NYC, making sure that we continue to message how important it is to do our core 4 prevention strategies and getting tested. A lot of information on our website, so please visit nyc.gov/COVID vaccine. We have FAQ documents, we have videos that you can also use in your own discussions with your family, with your congregation, or whomever, just to help them, support them in making an informed decision. Next slide. Great. And here are some additional resources. I think that should be the last slide.
Thank you, Dr. Easterlin. We need to ask at this time, what will Dr. Ige, at this point, what are you going to add to support what Dr. Easterlin just shared with us?
I'm sorry, can you hear me?
Yes.
Yes, I wanted to say that, Dr. Easterling has covered from the context of where we are right now with COVID and some of the strategies we're putting in place to get us back to normal. And I want to just add that we acknowledge that there are many people who are still struggling with accepting the information, accepting the vaccine, because they don't feel like they can fully put their confidence in the process, in the vaccine, or in the systems. So we're hoping that today this can be a safe space for people to share their concerns or the questions that they have, so that they can leave here feeling like they have all of the information they need to make an informed decision or to share with others. We know that.
I'm sorry.
We know that one of the most effective strategies is hearing from trusted messengers, trusted voices. And while we know that there are many people here who may be vaccinated already, we know that they're also connected with family and friends and neighbors who may still have questions about the vaccine. So it may not be your question, it may be from someone that you know, but we are hoping that today we can help provide additional information about what you want to know about the vaccine, or what you have had, you want to, other people who are close to you to know about the vaccine, so they can make an informed decision.
Thank you. I can see we have almost 100 questions that have been placed in the Q&A. And at this point, we are going to turn it over to our team, our COVID Townhouse team, and they're going to help present some of the questions to you and Dr. Easterlin. Mira?
Thank you so much, Annette. Thank you, Drs. Easterling and Dr. Ige. Yes, to Annette's point, we have many, many, many questions, and I hope we can address as many as we can. In the interest of getting to all of those questions, many are similar or build on one another, so we will group them as appropriate. But I will start in, one question that has come up over and over is, one, which of the 3 vaccines you outlined are most effective, and overall effectiveness of all the vaccines, meaning will we need to get a booster shot annually? So which, if any, is more effective, and then overall, how effective are they, and do we need to get them regularly?
So the best way to answer this is to sort of separate it out. We have information for the 3 vaccines based on the current epidemiology. And so what we know right now, all 3 vaccines are safe and highly effective. We cannot compare the 2 mRNA vaccines to the Johnson & Johnson. Those clinical trials happen at separate times. But we know based on the data from the clinical trials that did take place that they're safe and highly effective in preventing severe illness and hospitalizations, which is really, really important. So all 3 vaccines do prevent that. We've already seen some additional data that has come out just this week that even after the first dose, we've seen good protection for those individuals in making sure that we're preventing against severe hospitalization and death. And certainly after the second dose, we've seen even better protection for both the mRNA vaccines. And so to the durability question, that question, we just do not have the answer right now. We need more information. We know that we expect to receive additional data from the manufacturers as they are testing this out right now, really looking at additional boosters that can protect against the current variants. And we just also don't have the epidemiology for what variants are going to be concerned later this year and into early 2022. And so whether we're going to need a booster, cannot say for certain just yet.
Mary, do you have another question?
Yep,
Jesse.
Yeah, so thanks a lot, Dr. Easterling. So we've gotten a lot of questions about the emergency use authorization, which I think comes across as a scary word to some. Can you maybe explain what that means and how it relates to vaccine safety and effectiveness?
Yeah, absolutely. The emergency use authorization really allows us and gives the authority of how we can use the vaccine during a public health emergency. Really important to just reiterate, the clinical trials, the process of the vaccine development went through the same rigor, same process. There were definitely more scrutiny to the data to make sure that the vaccines were safe and effective. The emergency use authorization really allowed us not only the approval, certainly the Food and Drug Administration, the Center for Disease and Control looked at the data and able to approve the vaccines, but then being able to deploy and get these vaccines out widely during a public health emergency, that's when the emergency use authorization really extends and enacts its power, both from a manufacturing standpoint, also from a deployment standpoint, but then how we can administer these vaccines. And so the emergency use authorization was really important here in how we could really get these vaccines out far and wide and making sure that residents had access to them. But, it's important to understand that there was no shortcuts around this safety and really evaluating the effectiveness of the vaccine.
Thank you. We have a lot of questions as well from folks regarding allergies or other underlying conditions, and is it safe to get a vaccine, if you are prone to allergies or may have another condition?
I can speak to that. So allergies to the vaccines are rare. It occurs in about 2 to 5 per million. So it is not a common occurrence at all. If you've had allergies to a vaccine in the past, or you have had allergies to an injectable medicine, then we want you to please check with your provider to be sure you are not allergic to any of the components of the vaccines. But otherwise, allergies to food, allergies to pet, allergies to pollen, those kinds of allergies are not a problem for this vaccine. So you should only be concerned if you've had allergies to vaccines in the past or injectable medicine. I will also say that the way vaccinations are done also includes precautions to address allergies if they do happen. So at all vaccination sites, you're observed for 15 minutes after your vaccination to be sure you don't develop a reaction, because reactions tend to occur within that window. And at city-operated sites, we have EMTs on site and medical personnel who are able to respond should there be a reaction. So if you've had allergies before, please check with your provider.
Thank you, Dr. Ige. Another question that's come up a lot in the chat is, after getting the vaccine, is it still important to get tested? And what should people with the vaccine do to protect others?
So after you're vaccinated, certainly, just take, for instance, if you're vaccinated tomorrow, April 1st, and you receive your second dose. So for the next 2 weeks, you certainly want to make sure that you continue to do all the things that you were previously doing. If you were doing weekly testing, continue. If you were not doing weekly testing, start. We want to just reiterate that after that second dose, you have not achieved the full effectiveness, the full immunity. And so that doesn't happen until 2 weeks after the second dose. And so really important to continue to, get tested, continue to maintain your distance from those who are not in your household, continue to wear your mask, all the things that you were certainly doing. Now, 2 weeks after that second dose, there are some changes. You do not need to do weekly testing. If you are exposed to someone with COVID-19, you do not immediately need to test or isolate or quarantine unless you develop symptoms. So CDC was very clear that how we define a fully vaccinated individual is 2 weeks post that second dose. And so it's really clear that we want to make sure that individuals are following those guidelines. If it happens within the 14 days, you're exposed to someone with COVID-19, you should immediately get tested. You should quarantine. You should do those things as you were if you were not vaccinated at all.
Great, thank you so much. As you might imagine, we have questions about the effects of the vaccine on your DNA, or what if any effects or alterations does it make to your genetic makeup?
I can speak to that. So the two vaccines that use the mRNA, the Pfizer and the Moderna. So mRNA is a messenger RNA. So that is a little piece of the genetic material of viruses. So this mRNA, their singular function is to carry instructions. And like Dr. Easterling described, they're eliminated from the body once their job is done. So they do not linger in the body. They do not go inside the cells or alter your DNA. Your DNA is in the nucleus. They do not go inside the nucleus of the cell, cause any alteration in your DNA. So we like to describe it this way. They're like an email. You get an email, you read the message, and then you delete the email thereafter. So this is what messenger RNAs do. And they carry the instruction, the body decodes the instruction, and they are eliminated from the body thereafter. For the Johnson & Johnson, it's the same process. It's just that the carrier of the message is different. It uses a viral vector instead of an mRNA, but it's the same process. The message is decoded and the viral vector is eliminated. So there is no fear that there will be DNA alteration or any changes in your cells or body as a result of these vaccines.
Thanks a lot, Dr. Ige. Another big group of questions is about variants and how, and there's concern that the vaccine won't be effective. So what's the point? And maybe you can go into some detail on that.
Certainly, I'll jump in there. So it is a really good question and certainly a good concern. One thing that we're certainly looking at is immune escape. And so, our folks who are vaccinated being reinfected with the variants of concern, and second, whether or not the vaccines are resistant. So to the second question, we have no evidence that the vaccines are resistant to protecting individuals against the vaccines. And actually, there is some effectiveness of the vaccines in protecting individuals against those of the variants. And so that's really important and provides some protection. And certainly we need to look more as we're learning more about the vaccines and the variants. We're not seeing individuals getting reinfected, but certainly we're still early and we need to capture more information. And so I think it's really important that because of the presence of variants, maybe one of the reasons why we continue to see persistently high cases and hospitalizations, and certainly this is a concern. The high number of cases are occurring in New York City, and more than half of them are some type of variant, whether that's the UK variant or the New York City variant or another. So certainly this is the reason why we have to do all of the prevention strategies or continue them while we're rolling out our vaccine strategy. So just the upshot here is some effectiveness against the vaccines for those who've already been vaccinated and fully vaccinated. So that is promising. Still need to learn more about how going forward the vaccines could be used to protect further against the variants. And then we just don't know yet if there's going to be a booster vaccine or something of that nature. So more information to come there.
Thanks so much. We have a question about, is there a difference in effectiveness or perhaps the side effects with regards to somebody's race or ethnicity?
So I'll speak to that. So all three vaccines went through phases of clinical studies, and they involved thousands of people. So for Pfizer, there were 24,000 volunteers, and about 30% of them were people of color, including Black people, Latino, and Asians. For Moderna, there was about 30,000 volunteers. Again, a similar proportion, about 30% of the volunteers in the clinical studies are people of color. And the same for Johnson & Johnson. And the data points to the fact that this vaccine works the same for people of color and across ethnicities and racial backgrounds. And it also works the same for people of different age groups. So we're confident that this vaccine works the same based on the clinical study. But we also, like Dr. Easterling shared in his presentation, that we have over almost 140 million people who have been vaccinated across the country. And in New York City alone, over 3.4 million people have been vaccinated, including people of color. So again, we're doubly confident that this vaccine is safe and effective and works the same for different ethnic and racial groups.
Thanks a lot, Dr. Ige. On the trial information, there's some questions about the long-term effects of the vaccines and how do you test for those long-term effects in such a short time period since they were approved?
Good.
Yes. So we draw our information for how we know vaccines work generally, and also based on the technology that these vaccines use. I said earlier on that the mRNA and the viral vector technology used in the three vaccines that are authorized for use, they do not linger in the body. So they have a function which is to help the body develop antibodies And once that's done, once the antibodies are developed, they're eliminated. So based off of that process and what we know from biology, we do not expect that these mRNAs or viral vector will then show up 5 years later or 10 years later with an effect, because their function is time limited and they're eliminated from the body. So it's one of the reasons why there is not an expectation that there will be effects showing up much later down the line. All of these 3 vaccines were studied for at least 2 months before they were authorized for use. So again, if you think about the biology, 2 weeks after your first shot, you develop, after your second shot is when you have your full antibodies and you're fully protected. And for COVID, you know that it only takes about 14 days for symptoms to show up. So I can know pretty quickly if the vaccine is effective or not. So these vaccines, it's not expected that there will be long-term effects down the line. However, those who were part of the clinical studies continue to be followed up, and they will continue to be followed up for up to 2 years, so that if there is anything that emerges around along the way, that will still be identified. But so far, so good. There's not been any report of any serious adverse events, and monitoring for safety continues, but it's not expected that something is going to show up 5 years or 10 years down the line just because of the biology and how the body processes these vaccines.
Yeah, and just one thing I just want to add, and really, Dr. Ige really laid it out very clearly. In addition to, sort of monitoring and tracking those individuals who have been part of the clinical trials, CDC also has a vaccine safe pregnancy registry and are, continuing to monitor individuals, and that is voluntarily. Somebody could enroll in the registry just to report any symptoms or any concerns related to pregnancy. And there have been no safety concerns. There have been no signals to say that vaccines have impacted persons who are pregnant once they were vaccinated. So that's also a really positive note to just underscore that the vaccines are also safe for those individuals who are pregnant, and it is recommended as well, even if you're breastfeeding as well. So really important note to just mention.
Great, thank you. Dr. Easterling, you actually just answered the question that I was about to ask about people who are pregnant or are in their childbearing years. So it sounds like it is safe and that you are tracking, any potential issues that may be reported from that. So I'll ask another question about that came up a couple of times about the 2 mRNA vaccines. Why are they not interchangeable? Meaning, and also why am I being asked to schedule a second appointment at the same location if I can get it somewhere more convenient? Is it required to get the second at the same location as you got the first?
Yeah. So for the mRNAs, there are some differences about the 2 mRNA vaccines, and from a handling storage capacity, the big difference is that the Pfizer vaccine is required to be stored in sub-zero temperatures, whereas the Moderna vaccine also sub-zero, but not as low, but also has a longer shelf life. And it's really based on the solution that the vaccines have been developed in. The Pfizer vaccine has some different components to its structure, mainly that it is lipid soluble, where the Moderna vaccine is not. And so because of those differences, and also the clinical trials were not tested where one person received a Moderna vaccine as the first dose and received the Pfizer vaccine for the second dose. And so not knowing what the effectiveness is in protection, we do not recommend that someone interchanges the vaccine. Now, under certain extreme situations where someone may start off with a Moderna and unable to access, maybe thinking about a rural area or some other circumstance, that may be a situation where that person may need to get a different mRNA vaccine. So maybe they will have to get the Pfizer as their second dose, just because the Moderna vaccine was not available. But we're not in that situation anymore. Supply has been more steady as well. And so to the second question about the requirement is in place. It is a state requirement. You do need to go to the same location to get that second dose. One to ensure fidelity to the process of making sure that you're going to the same location and receiving your second dose. And so this is just the process that we want to make sure to make sure that folks are getting that second dose, which is why it's required to go to the same location.
Thank you, Dr. Easterling. We've gotten many questions from people who have tested positive for the antibodies, wondering if they still need to get the vaccine and what the benefits are at that point.
The answer is yes. Even if you've had COVID before or you currently have antibodies, getting vaccinated will only boost your immunity or to complement what antibodies you have. The reason for this is that there is a possibility of reinfection even if you've had COVID before, because antibodies tend to wane over time. So it is recommended that those who have had COVID before still get vaccinated. If they're going for the 2-shot vaccine, they should still get their 2 shots. And if they're opting for the Johnson & Johnson single-shot vaccine, that is also fine. But it is recommended that you still get vaccinated even if you've had COVID or you currently have antibodies.
I see, Mira, we are coming up on under 5 minutes, so I think we might have room for about 1 or 2 more questions.
Sure. I think, Dr. Ige, you answered this a bit in your last question, but there was one about from an individual that did not have side effects. So was vaccinated, did not have side effects. Does that mean they are less immune or immunity did not build?
Oh, no. So the side effects from the vaccines, it's not a given. It's not everyone who will develop those side effects. So it varies by the individuals. We just like to let people know what to expect. And so they're not worried if they do develop the side effects. So those side effects are, yes, linked to your body developing immunity, but not everyone will develop those side effects. So no cause for alarm if you do not have those side effects. Older people also tend not to have as many side effects as younger people.
Great. If I could ask one more question, because this came towards the end. This contributor says that all these comments have been focused on the positivity of the vaccines. Mm-hmm. What are some of the cons or potential cons or concerns? And at the same time, is there any body or group of people who should not be vaccinated or not get the vaccine?
I can say some things. We're focusing on the positives because we know that vaccines are an important tool in how pandemics end. You know, right now we don't even know what smallpox is. It's been eliminated from the entire globe because of vaccination. Measles, chickenpox, several diseases that we grew up feeling were normal. Now my children don't even know what that is because of vaccination. So we know that the vaccines are a game changer in pandemics or epidemics of infectious diseases. But it is also important to acknowledge that vaccines also come with some side effects. And the side effects from these vaccines are similar to what we will expect from other vaccinations. So if you get a shot in the arm, you can expect that may be sore for a couple of days. Some people will get, a little fever, a slight headache, some tiredness. When I got my second shot, I was off a little, and that happens. But this slight discomfort, I think it's worth it when you think that we can get people out. We can get people out of the hospital beds, and we can stop deaths. I want us to remember that in the last year alone, we've lost over 500,000 people to this pandemic in 1 year. In New York City alone, 31,000 people have been lost to this pandemic. And now we have something that can stave off the preventable deaths. So, we're excited about it because of that. If I know that I can take a shot and I know that I will not die from COVID, I'll go for it. So that's what these vaccines offer. All three of these vaccines have 100% protection against mortality. So you know that you're not going to die from COVID. I think that's something to celebrate. So it's why we're excited, it's why we're promoting this, because it's such an important tool that we have to help get our city back and help get us back to normal.
Now, that is the most exciting part of our program. And I thank you, Dr. Ige, for bringing us to this conclusion on such an uplifting aspect of it. Because you could say there are 500 plus people who will not be at birthdays, at dinners, at important events. And if we here at the MTA can say, well, we have lost colleagues, but let us not lose another colleague. Right. We are at that hour, that moment. But before we close, I want to share a proverb, not biblical, but African, which says, knowledge is like a garden. If it is not cultivated, it cannot be harvested. Dr. Easterlin and Dr. Ige, you have shown us that you have both cultivated your gardens of knowledge, and today the MTA was honored to have shared because you were so generous in what your bountiful harvest was. We are thankful, and I'm speaking on behalf of the MTA. We are thankful, we, the MTA and the COVID Town Hall team, for what you gave us today. There are not enough words. Knowledge shared. Think about the over 600 persons who listened to your voices today and have walked away with more information. We are honored and we are ever so grateful to you. We thank you both. We thank you. We thank you. We thank you. Now, this is a reminder for the MTA team at large. You can reach out to us and share feedback and even continue to ask your questions at teamvaccine, one word, at mtahq.org. Or you can go to our COVID website, which is www.mtainfocovid19, and there you'll find additional information and resources. And for everything vaccine, we have the WWMTA Info COVID-19. I look forward to hearing that more of us have been vaccinated. I have had both of mine, and I am pleased to know that I don't have to worry about dying. So to all of you, again, thank you, Mira, Jesse, the whole team. We have come to the end of this very exciting conversation, and we are gratefully honored at your presence. Dr. Easterlin, Dr. Ige, thank you so very much. Thank you.
Thank you all.
And we are done. Mira?
Take care. Thank you.